Today we are going to check on pediatric emergency and ETAT and IMNSCE, integrated management of newborn child infections and illnesses. So look at this. This is just one of the units that is covered by Kenya Registered Community of Nursing, courtesy of medical students right now. And today's topic, we're going to check on poisoning in children. So that is what we're going to check on today. Okay, so poisoning in children, that is, you start from the definition. A poison is any substance that harms the body and interferes with the body's normal functioning. Poisoning can occur through poison ingestion, like paraffin, right? Paraffin actually. Remember, sometimes back, it was in 1999, took over, we migrated off in a very small house. And so I remember there was no water at that duration, like it was a drought in that region. So it was around 7 p.m. in the evening, almost tonight. And then I happened to see or spot a very transparent and clean bottle of water with content like water. So I assumed, because we were very many in the house, nobody could hear me calling for water. So I just sweep it and I took it all, nikaikunywa. And then on drinking, it happened that it was paraffin, yeah? It was paraffin, and I was a young boy, actually, kind of a young boy. So I never even realized that it was butter. I realized later it was a paraffin. I remember there were a lot of first aid options given to me, but I never died, but I survived, right? It was very tremendous in a way. So poisoning can occur through poison injections, when you take paraffin, when you take paracetamol, alcohol, right? Paracetamol, the mode of let me just say metabolism of the paracetamol and alcohol, they almost symbolize, or maybe similarly. Both of them, for long consumption, interfere with your liver, so you can have hepatotoxicity, both paracetamol and alcohol. So insecticide also, you can inhale insecticide, inhalation of carbon monoxide, organophosphate poisons, skin exposure, eye contact, or any other mode that can cause adverse effects. And so these are type of substances that you are supposed to be very precautious about, and no children should be exposed to such. Ingestion accounts for the majority of poisoning at most, and you need to know that the pathophysiology will depend on the type of poison and the site of entry to the body. So let's check on the clinical features of poisoning, or how poisoning manifests itself. So vomiting and hematemesis. Vomiting is just puking, right? Then hematemesis, that is now vomit, but a vomit with blood content or traces of blood. Another one is convulsions or involuntary movements. Yeah, more of like seizure. I can realize some people present like epileptic in a way, and they produce palm of, the foam from their mouth. We have oculogyric spasm can take place in your eye, hallucinations and agitations. You're seeing things which are not real, and you feel like you're scared, you're weird. People, they're like getting surprised or hallucination of some sort. Pupils either dilate or constrict. And then there will be renal failure. There will be no renal output at a kojoa at some point, or maybe at a kojoa excess. You will be urinating throughout. So either he urinates or doesn't. Respiratory failure can come into play as well. Lack of breathing, or you find on difficult breathing, what you call the dyspnea, right? And then the tachypnea, faster rate of breathing. Then we can have cardiac failure, resulting to a shock, hypovolemic shock, right? Hypoglycemia. There will be a very intense or acute fall in the blood sugar level in the body. And then we have metabolic acidosis as well. Metabolic acidosis, which can be due to improper metabolism, resulting to increase in acidic content of the body and the blood, or maybe due to reduction or reduced release or secretion of acid off from the body. So when the eradication of acid substances are not evaluated due to fall in metabolism activity, or the metabolism is on poignant in a way that lactic acid is produced, we can have stupor or coma, what we call stupor or coma. at long last. Those are the manifestational clinical features of poison. So general management, how do we manage such conditions? First, it will depend on the type of poison I talk about taken by the child, the time span since it was taken, and the route of intake. So some poisons have antidote and some do not. So the place where the patient is being cared for will also be of great importance because of the availability of the equipment, supplies, and qualified personnel. Some of the general actions which can be taken in the management of poisons include the removal of poison from the body if these are known. This involves provoking vomiting, emesis, that is, you trigger unamfanya tapike with the fingers. Some people take fingers and put them on their upper palatine or maybe towards the upper or lighter pharynges. Then it will make them to wachukua kidole naingiza huko kwa mdomo, unashika rufu ya mdomo na huko nyuma. Then it will make them to vomit. Yeah, so that is that. For non-corrosive and non-inhalant injection poison, you can use that. Ipecacuanha syrup may be used instead of the above. Ipecacuanha syrup is one emetic substance that will make you to vomit immediately. It's called the ipecacuanha syrup. So this is given as a dose of 15 mils. Start orally, followed by 200 mils of water. Then you wait 15 to 20 minutes for the patient to vomit. If there is no vomiting, repeat with a dose of 15 mils orally and wait 20 minutes. If the patient still has not vomited, perform gastric lavage. Gastric lavage is now that tendency of evacuating or removing everything from the mouth by negative suction, using the tubing, the nasogastric tube. So that is that. Continuation of the management, that the blood should be tested for the poisonous taken. An intravenous infusion using the Darrow solution of 50% dextrose may be given to correct hypoglycemia. Then oxygen therapy can be administered where necessary. That is when the oxygen, or maybe there's a breathing problem, or maybe a circulation problem. The child should be given an oral alkaline fluids to neutralize the acid and the vice versa. So if it is acidic, you give alkaline. If it is alkaline, you give acid. Things to do with sodium hydrogen carbonate taken, you'll give an acid compound. So urinary catheterization is indicated in order to monitor urine output, because I told you we can have a risk of renal failure. And then the patient's general condition should be assessed to include level of consciousness and inspection of the mouth and lips for any burns in case of corrosive poisoning. Neurological investigation should also be undertaken. Glaucoma scale is also necessary for that case. So let's check independent poison, starting with paraffin poison. Young children drink kerosene by accident, like I told you about my story. It's kept in the houses as well for lamps or primer stoves, and is often kept in an old juice or soda or beer bottle, or even water bottle like my case. So a child will usually not drink more than a mouthful because of the unpleasant taste. So you just first test, but if you flush, ukiwa mtu wa kuflush, you will just flush it. So clinical features, the main danger lies in the aspiration into the lung, causing bronchopneumonia. So if it goes into the lungs, you'll have the bronchopneumonia. For this reason, vomiting is dangerous and should never be induced. So the kerosene also can cause acute pulmonary edema, that is still under the respiratory effect. Another immediate effect may be coma due to narcotic effect of kerosene. So it will stimulate you in a mild way. Management: do not induce vomiting and do not wash out the stomach. Right? Give 5 ml of milk of magnesium as a laxative instead. Laxatives are drugs which enable you to pass. It increases your gut motility, and therefore you can go into large. You can defecate. You can go into toilet and do the bowels movement would be free. So you can remove it through the anus or rectal route. Pneumonia is such a common complication that it pays to start pneumonia treatment immediately. That is, if at all the kerosene is the poison. So go and read and make notes on acetaminophen poisoning, that is paracetamol. Then insecticide poisoning, parathion, malathion. Parathion is one of the elements and parathion is another one. These are the key poisons that are mostly associated. So contact with these poisons causes tremors of the muscles, unatetemeka magoti kila mahali. Sweating, a lot of sweat, copious secretion of saliva. You are really you produce saliva in large, some of the saliva floating off from your so you form a form of saliva in your mouth. Lacrimation, pinpoint pupils. In the latter stages, it causes convulsions, coma, or paralysis. The pinpoint pupils can help you make this diagnosis and guide you in the treatment. The treatment consists of first washing the child with soap and water if there has been skin exposure, then give them very large doses of atropine intramuscular. And what is the effect of atropine? Right? You need to know these cholinergic drugs. So in children under 5, 0.5 milligrams, and in older children give 1 milligram atropine sulfate that is intramuscularly every 15-30 minutes until the pupils become wide. Convulsion disorders, childhood seizures, that is next thing we'll do. Causes of the seizure, we'll check on them, diagnostic funding of the seizures, and the rationale of the seizures. We are going to do them in the next check out. Or let me just have them here today, so that because I can see it's only 11 minutes. So when we talk about seizure, there's a great deal beyond more compiled than this. We shall check them later on. But here we have convulsive disorders, childhood seizure. Seizure is a sudden episodic involuntary alteration in consciousness, motor activity, behavior, sensation, or autonomic function. Causes of seizures, you can have the cause of seizure. We have excessive neuronal discharges, like in epilepsy. What I'm trying to say that seizure is defined by the symptoms, like sudden episodic involuntary alteration in consciousness, to mean vile unafikiria, vile una behave ina change mara moja. Motor activities, you start to tremor, like convulse, you behave in a weird way, sensation, autonomic function started to change suddenly. So what can cause seizure? The main cause is normally a burst in the electrical discharge in your brain. So that is what we call excessive neuronal discharge epilepsy, in bracket. So hyperexcitable nerve cells. Remember, we have a threshold on the nerve impulse transmission. That is when you talk about the polarization, right? Yeah, the hyperpolarization, depolarization. So at a point, the nerve cells are supposed to be excited in a normal way, but if there is high energy burst beyond the charges or the electrical potential difference that we expect, we'll have hyperexcitable nerve cells that will surpass the seizure threshold. Therefore, neurons overfiring without regard to stimuli or need can also cause that. So when that happens, normally it's due to maybe ulianguka, you have an history of fall, or you have an history of meningitis, because children are faced with meningitis at young. They also present with convulsion seizure-like symptoms. So we have classification of seizures depending on whether they're general or simple, and that one we'll check on the other time. But here we just have to see diagnostic findings of seizures. Diagnostic findings of seizure, first you'll do the EEG, right? That is the encephalocardiogram, or the encephalogram. Resulting help differentiate between epileptic from a non-epileptic seizures. Each seizure has a characteristic EEG tracing, because with the encephalogram planted and all the nodes are attached on your brain or your head, the sequence of firing of your impulses are indicated in the screen. So by that we can rule in and rule out epileptic seizures depending on their characteristic. So away from that one, nothing diagnosis of seizures, you can say ineffective airway clearance, risk for injury, disturbed sensory perception. That is nothing diagnosis. Intervention or rationales of seizures, you can say you have to monitor vital signs to determine baseline values and detect any changes. Monitor neurological status to detect changes. So you have to monitor vitals. That is very clear. Then you check on the neurological status to detect changes. Kama alikuwa na blink out, is now blinking, right? If he was talking, rightly talking now, stay with the child during a seizure to prevent injury, because some of these uncontrolled motor effect can result to them running and falling themselves to the objects, and they can cause injury to themselves. So move the child to a flat surface to prevent falling. Then you're supposed to place the child on their side to allow saliva to drain out to ensure a patent airway. And do note try to interrupt the seizure to promote safety. So the moment you do interrupt the seizure, it's normally like you're catalyzing it. Gently, why do we place the child on their side to allow saliva to drain? Because actually there's that increase in saliva production during this, right? So gently support the head and keep the child's hand from inflicting self-harm, but do not restrain the child to prevent injury. Reduce external stimuli to avoid worsening seizure activity. Loosen tight clothing to promote comfort. Record seizure activity. Description of seizure activity helps to diagnose the type. We remember we have different classifications. We have the aura, the first phase of the nini, and the last phase of the seizure. You need to know, right? You need to note them down, and we're going to check on that one when you are going to be handling seizures at large. So you need to monitor serum levels of anticonvulsant medication such as diazepam 0.5 milligrams. So you need to check on the levels such as that one. Diazepam is one anticonvulsant which is used. You give it per rectal or 0.3 milligrams per intravenous injection. So look at this. If it is 0.5, that is per rectal, but you can do 0.3 per IV. You can also give phenobarbital 20 milligrams per kg start, then further 5 to 10 milligrams per kg can be given within 24 hours of the loading dose, with maintenance dose of 5 milligrams per kg daily to prevent toxicity or subtherapeutic levels. Do not use tongue blades. Tongue blades during seizure activity. This may cause trauma to the mouth and result in airway obstruction from the aspirated tooth or laryngoscopy, the laryngospasm. Look, these are not. You should not protect the tongue by putting the tongue blades, because if you protect it, it will cause more damage by what you are using to protect it. At most, when you always think of doing this, the child has already suffered. Kama ni kuuma ulimi ashauma tayari. So the teaching topics of seizure include the following: use drug for controlling seizure, instituting safety measure during seizure activities. Those are the key things. So that is well done. Yeah, there's an assignment for you. Right, what about burns in children? Degrees of burn, rule of 7 in children. Kindly find out foreign bodies in the orifice. Check on your first aid notes. Shock, refer to your first aid notes. Choking, that is choking, refer to your. So these one are all in your first aid guides. Pediatric AIDS, bucket lymphoma in pediatric also is very important. So away from that one, we can also have time for all this. There's no need if you can't. Next time we are going to do emergency triage, assessment and treatment plus admission, the ETAT. We shall check on the ETAT, the acronym ETAT, on our next class. Thank you so much for for availing yourself in this lesson today, and have a nice time. Don't forget to subscribe, and don't forget to share our video link. Thank you. This is Auma presenting.